what happens is that when your body is in an immunocompromised state because of some chemotherapy or due to some disease or due to induced suppression by drugs such as steroids, just like the ones used extensively in treating COVID patients to reduce their inflammatory response. What happens is that the opportunistic infections, as we all call them, they gain entry into our bodies through our passages, like our mouth and also our nose. So in these cases, what happens is that one of the deadliest ones is fungal infection. And there is a species known as the Rhizopus species, as many plant botanists know it. If you have seen a sugarcane stem and you've seen a blackening at the base of it, that's exactly the friendly species, the brother species of the same fungus. But when it invades a human body, it would go through these defenses and then causes a widespread destruction of tissues because it goes through the bloodstream really fast and also through the nerves. And normally in these cases, there is a blackening of those areas where it goes, like, for example, it goes from the mouth or the nose. You'll start seeing a black kind of a scab around these areas, maybe sometimes very painful or sometimes without pain at all. And then very rapidly, it can go into the eye, cause damage to the eyeball. And if it goes to the brain, then it is a fatal disease.
Yeah.
So yeah.
And so why do you think, I mean, is it the fact that COVID patients are in such a weakened state, their immune systems are so weakened that they've been susceptible to this?
So there is a myth and there is fact about it. If you have a mild COVID infection anywhere around the world, you don't need to worry because you haven't taken any immunosuppression. In fact, your body had sufficient immunity and it could fight on its own. At the most, you needed a paracetamol or things like that, a vitamin, that's all. But if you had to take steroids to suppress the immune response of your body, that immune system itself, the weakening that you caused due to the steroid, will invite other infections. And because in India especially, why would you say, we are a pre-diabetic population. There's a lot of diabetes in India. The sugar levels coupled with the steroids induce an extra immune suppression more than anywhere seen around the world. And that is causing this much higher rate in India.
So when we're watching, the images coming out of India, the hospitals like the one you're working in, you're under so much pressure. Is it that it is sometimes hard to quickly identify this and this is becoming quite a fatal consequence for many COVID patients?
Yes, especially so because the COVID centers at hospitals are no entry zones for anybody. And suddenly you have to open up a new window for the negative patients who have recovered from COVID. The family is financially, emotionally, physically ruined. And then suddenly they are put into a situation where they have to prepare for another disease. How bad it could be than this? And on top of that, you have to open up the operating rooms, the other areas of the hospital, re-guide your entire staff and doctors and who are fighting the COVID. All of them are tired horses, and now they have to deal with this devastating infection. Thankfully, it is not in the same frequency as the COVID infection. The cases are far and few, like 1 in 1,000 maybe. I don't have a data to support, but we are trying to bring about a consensus amongst various hospitals around. But the disease is so dangerous that, it brings about a lot of fear in everybody. That's the problem.
And Dr. Munjal, what about the longer term consequences? Even if a patient is able to recover, what can the longer term effect be?
So even in this case, the earliest detection, if it is done, you could escape without a problem. At the most, you would need an IV antifungal, which is called amphotericin B. And with that institution, if you do well, in a few days' time, you could go home with just the medication in the earliest few cases. But sadly, that's not usually the case. People are coming here with damaged eye visions and sometimes even cosmetic eschars on their cheeks, and they have to undergo mutilating surgery. So even if they survive, you're left in the long run, a young person at times without one-sided eye or a palate which is not functional, and sometimes a long-term period of a lot of medications, further dressings and hospital visits and things like that. Not to talk about a sudden case of death also, which is frequently occurring in one of these cases. So it's a little bit scary, definitely.
Certainly, and adding to the strain you're under. And we do appreciate you taking time out. I know you are under enormous pressure at the moment. Thanks so much.
It's a pleasure. Thank you.